Finding out your pet has cancer can be a scary diagnosis, but these days, veterinarians have a wide range of weapons to treat the disease. On this episode of the Paw Report, we're talking about radiation therapy and its ability to target tumors. We're joined by Dr. Kim Selting, who will discuss how the therapy works and its benefits. So stay with us.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Thanks for joining us for this episode of the Paw Report. I am your host, Kelly Goodwin, and joining us for today's episode is Dr. Kim Selting. She is with the University of Illinois Veterinary Teaching College, and she joins us today to talk about radiation therapy, a difficult topic because sometimes, you know, it can be scary for people when they find out that their pet has cancer. So very interesting topic today, and we thank you for joining us.
Thank you for having me. It's a good opportunity to help people understand what's out there.
Absolutely. Why don't you start by telling people about yourself and your background and how you made it to the University of Illinois?
Sure. So my quick update or background is that I grew up in Colorado, did a lot of my training there. I did an internship in New York City. I spent 4 years in private practice in St. Louis and then went back to Colorado for some additional training in medical oncology. And I did that on faculty at the University of Missouri for 15 years. And during my time there, I had maintained a strong interest in radiation oncology as well. And so I did a second level of training there and got a board certification for radiation oncology as well. And then the opportunity to come to the University of Illinois last summer was to focus more on the radiation oncology side of me than, and you know, so I do both, but I'm here primarily to build the radiation oncology side of things.
And we're going to talk about that because you've got some exciting changes in your department.
Yes.
Let's talk about how common cancer is in pets.
Sure.
That's what you see. So how common is it?
So common is, cancer is very common in companion animals. So we see about 1 in 4 animals will develop cancer in their lifetime, and about half of all dogs over the age of 10 will die of cancer. So it is a great concern and something that's commonly seen, and probably, you know, there's always a question of whether it's more common now or whether we're just noticing it more, and it may be a combination of both, but it's hard to separate those two, you know, so but we see cancer very regularly. General practitioners see it regularly. We do see a lot of benign cancers that, you know, that don't necessarily require treatment, but all cancers, all new lumps and bumps should be evaluated so that we know if we should worry about them or not.
Attributes, would you say it's genetic or is it environmental as far as the cancers you're seeing?
So cancer is multifactorial, and it's very rare that you would ever have a single cause and event, you know, effect. So, for example, in human medicine, there's an association with mesothelioma with exposure to asbestos, for example, or pesticides or other chemicals. But not all people who are exposed to that will develop lung cancer, and similarly, not all animals who have a certain genetic makeup or certain exposures would develop a cancer. But there's always some environmental factors and some genetic factors that contribute to the development of cancer. We have cells that probably go bad every day, and a lot of things happen in our body, like our immune system spends a lot of time going around the body all the time deciding what belongs there and what doesn't. And when cells become abnormal, most of those are cleared and taken care of. But when just the wrong combination of things happen, then a cell can escape those limitations of the body and develop a tumor.
Speaking of tumors, and you mentioned lumpy, bumpy.
Yeah.
I've had dogs all my life, and several of them have developed those, what I would call fatty tumors. Are those something to be concerned about, have checked out, or I had a black lab who had about a baseball size
yeah, they can
fatty
get quite
tumor
large
on her.
Yep, I think a couple of thoughts. I mean, certainly lipomas, as they're called, the benign fatty tumors, are very, very common. I think they always should be checked out when they're first noticed, because sometimes they can mimic other tumors that do require attention. If the veterinarian then samples them and finds that they contain only fat, and if they're behaving as would be expected, they're growing very slowly, they're not bothersome, then those may not require treatment and are just monitored over the course of the animal's lifetime. Occasionally they can require treatment because they are located in a location that creates discomfort, like in the armpit or in the groin or somewhere, or they just continue to grow to where they're making it difficult to lie down and get up because they're on the side. I've seen some very, very large ones. So sometimes we do need to treat those when they become bothersome. They don't transform into another malignant tumor, but they could mask a nearby tumor that, again, does require treatment. So watching how they behave and always having new lumps and bumps checked out is a good rule of thumb.
The big part of your job is treatment in the form of radiation therapy. What is radiation?
Radiation, a good synonym for radiation is energy. So energy, if you think about radiating, radiation is energy that moves across a space or a medium. And so when we talk about radiation therapy used clinically to treat cancer, which we're talking about pointing a very high energy directly at a target, i.e. the tumor and potentially the surrounding tissues, and using a machine to generate a form of radiation that, again, is very, very high energy and therefore can cause damage to the cells that is hopefully irreparable. And so if they cannot repair that damage, that cell will die off and be cleared away in the body.
What factors should a person consider before considering radiation therapy for their pet?
So radiation therapy is usually a set course of treatments, usually over the course of 4 to 6 weeks. There are ways to do radiation therapy that are accomplished in a shorter period of time, and we can talk a little bit about those if we have some time. But so there's a commitment. Radiation facilities are very costly to build, and the machines are costly to have and to maintain. And so, so the radiation facilities are somewhat few and far between across the United States. And so there is often, unless you happen to live very near a radiation facility, there has to be some consideration about time and travel, time spent away from your pet if you're going to have them, go through a course of radiation that, for example, takes 4 weeks to administer, where they get a little bit every day, Monday through Friday. They may come home on weekends, but they might be away from home for a while. So we consider things like long-term prognosis, and if this really makes sense for them to be away from home for that period of time, cost, whether there's any considerations for anesthetic risk, and again, certainly the efficacy towards that particular tumor and whether this all makes sense within the scope of their life. I mean, our goals are the same as owners. We want pets' lives to be better, and so our quality of life is always first, and quantity of life is a close second, because we're doing this because we want them to enjoy more time with their family and the families to enjoy more time with their pets.
Mm-hmm. What kinds of tumors do you target with radiation therapy?
So radiation therapy primarily treats where it points. There are some potential bystander effects that could affect things like the immune system and other aspects of the physiology that could affect the rest of the body. But primarily we use radiation as a local treatment. So we treat tumors that can't be well treated with surgery alone. So sometimes we do surgery, but the tumors are very invasive and they leave behind little microscopic cells that are eventually going to grow back. And so radiation to treat that surrounding tissue to eliminate those abnormal cells so that it doesn't grow back. Local soft tissue sarcomas, tumors that are in locations that are difficult to remove with surgery, like in the brain, in the nasal cavity, in the pelvic canal. There are several there. So nasal carcinomas, carcinomas of the perianal region and up in the pelvic canal, and so those would be a few of the common ones. We can also use radiation for palliation, so we can use it to make them feel better without using enough radiation to cause side effects. So things like decreasing pain associated with a bone tumor, decreasing, if you have a big tumor in the neck that's causing difficulty eating, breathing, swallowing, you could potentially give some radiation to that area to get it to shrink back, be less painful, be more comfortable, even if the tumor is going to be involving other parts of the body and the radiation is not going to treat those other parts. We can make them feel better, in that spot that's causing them a decreased quality of life.
Are there certain cases where radiation therapy may not be as effective as it would in comparison to another situation?
So certainly there are tumors that are systemic by nature, like lymphoma. There are tumors that are highly metastatic, like hemangiosarcoma, which is a common tumor of the spleen. Osteosarcoma is a bone tumor, and we can use radiation in certain situations to make those patients feel better or make other therapies more effective, but by itself, radiation wouldn't be a primary treatment as the only treatment for those kinds of tumors.
How does it work? I mean, you mentioned it, is laser the right thing to say? I mean, how does exactly, if I bring my animal into you, how does the whole process work?
So if you think, two aspects to that. There's the mechanics of how it works. In other words, they come in, they stay with us for a period of time. They undergo a brief anesthesia because we need them to be completely still, and not just completely still, but we often, have them in kind of a funny position to get the target that we're pointing at. So if the tumor, for example, is in the neck, we may have them, laying on their back in kind of a funny position. So they need to be anesthetized for that. So brief anesthesia, they wake up, they go home. We treat lots of animals where they have that done every day, Monday through Friday, and they fall asleep and wake up very crisply, and the impact of their quality of life is very minimal. As far as how the radiation therapy does its job, the goal is to damage the DNA of the cancer cell. And if we can cause, if you remember your biology class with the double helix, of the DNA, the strands, the strings of DNA, the goal is to create breaks in that strand so that when that cell tries to make two more daughter cells and make a bigger tumor, it can't do that because the DNA has been damaged. And when the little readers go along to try to duplicate the DNA to make two cells out of one, it gets stuck and it can't do that because it drops off or there's been breaks in the DNA. Usually there are lots of single strand breaks because remember there's two parts to the strand of DNA to that double helix. So we cause one strand break, but if we can get a second break in that strand nearby, then a double-stranded break is very difficult for that cell to repair. So, so that's we accomplish that in a couple of different ways with our radiation protocols, but the goal is to damage the DNA so that the cell can no longer divide, which means it is really important because it means that the tumor may not shrink right away. We sometimes see if we treat a tumor that is still a macroscopic or visible tumor as opposed to microscopic cells, when we're treating something that's measurable, it doesn't necessarily shrink right away. Even if we've been completely effective, we're trying to sterilize those cells. If the tumor never grows again, then we've still won. We've still accomplished something with that radiation, even if there's still a nugget of dormant tissue left behind, as long as the quality of life is good.
And those are absolute benefits to this process, but I'm sure there's also some risks associated with radiation therapy that you have to discuss with pet owners.
We do. We always talk about the side effects. It's always, everything we do is benefit versus risk, and what's the impact on the pet and what's the impact on the owner, and does this make sense? And each owner may choose a slightly different option based on what's right for them and their pet. I will give you an example. I have two dogs. I have one dog who is very, very timid, and I would choose a different path, a different course of treatment for her than I would the other dog who's very outgoing and happy and really doesn't mind being in the hospital. And so I would probably make some different decisions for the two of them if they had the exact same diagnosis. So it's always a discussion about what makes the most sense for that pet and that owner, given the prognosis that they have. So, but side effects, we divide primarily into early and late side effects. So the short-term side effects that we see with radiation include a radiation dermatitis, which is something like a sunburn, and that is if the tumor is close to the level of the skin, so that our radiation includes the skin in its target and in its focus, then you can see some redness and moisture and scabbing. That is short term. Those happen if you have the skin in the field. That will happen to some extent to all animals, and then it will heal in all those animals over about 2 to 4 weeks time. So the short term effects are temporary. Long term effects are rare, but if they happen, they can be permanent, and that would include things like loss of nerve function, a little damaged spot of bone, things like that, some scarring that that may or may not cause a problem. So, and the risk of those is just a few percent. That's how we design our radiation protocols. That's how we do each plan, is to minimize the risk of those late effects.
Can you use radiation therapy in conjunction with, say, chemotherapy or other surgeries if the case is severe enough, I would assume?
Yeah, and even for example, so not even so much severity as the appropriate treatment for the tumor. For example, a brain tumor, you might be able to, a lot of brain tumors are technically benign, but they cause malignant effects on the body because they're in a closed space in the skull, so they push on the brain as they grow and push things out of the way. You might have a brain tumor that actually can have some of it removed, but you leave some behind, and the radiation can work very nicely with that to help keep it from growing back. So a combination of surgery and radiation therapy is very common for controlling local disease for certain tumors. A combination of either surgery and chemotherapy, or surgery and radiation and chemotherapy, or radiation and chemotherapy gives you a local treatment and a systemic treatment for tumors that are have a local problem, are aggressive locally, but also have a tendency to spread elsewhere, and that's where the chemotherapy comes in.
Do each individual patient, or will each individual patient have a different plan as far as how severe, how large the tumor is, that will dictate treatment? So you could have treatment a couple times a week, every day, for 2 weeks, for 4 weeks, for 4 months, for 6 months. Does it vary?
So we usually try to complete their course of radiation in about a month, because there are some things that happen with the tumor growing back more quickly if you draw it out over too long a period of time. I encourage people to think about radiation as a treatment that is divided into the number of pieces, or we call them fractions. So the number of smaller treatments that add up to one big treatment, but that's the treatment, is the whole course of radiation. And then we divide it up based on what normal tissues are nearby, what the tumor type is that we're treating, what our goals are for the patient if we're treating them definitively, in other words, treating them with as much radiation as we can safely give to get the best tumor control possible, versus palliatively, which means we're giving radiation that is meaningful and will decrease symptoms, but won't control the tumor, for as long as a definitive protocol. But we're doing that because we're minimizing side effects.
Now, after each individual therapy session, will a pet owner notice some, we talked about side effects, but I guess I'm thinking more of nausea, vomiting, do their eating patterns change, are they sleeping more, anything noticeable that when your dog comes home that you're going to have to adjust to?
Not typically. I think certainly because our patients can't be told to lie still and they have to undergo anesthesia, while we don't see physiologic problems with the repeated anesthesias, I do think it's tiring for the animals to be in and out of the hospital and traveling a lot, and so I do have owners that tell me that when their dog went home, or their cat went home and slept for a long time, longer than usual. So I think they get tired, but I don't see that. I see that as a side effect of the process and not necessarily of the radiation itself or of the anesthesia. Radiation is only treating that one spot, so we don't typically see nausea, because radiation's not, we don't usually irradiate things that are inside the belly because they move around a lot, and we need things to be in one place to use radiation to point at them.
What happens after the treatment? So after an animal has gone through treatment, what is the responsibility of the pet owner? I think the magic question everybody wants to know is it going to work? Is my dog or cat going to be alive for a few more years? I mean, that would be the first thing that I would ask you if I brought a pet in.
Yep, and that will depend on the tumor type, and it's important also to remember that we can give you what we call a median survival time, which means the middle of the road, or something like an average survival time. It doesn't mean that's how long your dog is going to live. I can tell you that the average survival is about a year, but if it's the middle of the road, that means that half of the pets in that report of 30 dogs or 50 dogs or 20 dogs didn't make it that far, but the other half are still going strong. So we do all that we can to help you know if your dog is likely to be in the good half or the bad half. And again, setting expectations and good communication is really important to make sure that you know why you're doing this and what to expect. But I think as far as what you do when you come home, I think those side effects, the short-term side effects that I talked about, usually will start towards the end of the course of treatment, and then they will get a little bit worse after we're done, and then they'll get better after that. So one of the most important things that I tell owners is your job is to keep them from fussing and bothering and licking at it, because they'll make it worse than even the radiation can do if they chew and lick and fuss at it. So letting those side effects heal, giving them pain medicine, anti-inflammatories, just keeping them comfortable for a few weeks is the pet owner's primary job. And then we set regular rechecks. We talk about what comes next depending on the cancer type. We say we need to see you back in 2 months or 3 months, or depending on what we expect of that tumor from the sort of personality of that tumor, how it would typically behave. We look at set intervals and then we go from there.
Is the regime the same for cats? Is it,
Yeah.
Do you treat dogs and cats the same?
Well, the same in that they still must be under anesthesia to be very specifically positioned so that we can accurately treat our target. Cats are smaller than most dogs, so we often have smaller targets. I think that other than that, the form of radiation that we are getting at the University of Illinois will include computerized planning. So they'll go through a CT or a CAT scan to tell us where things are in space, because everything about radiation therapy relies on knowing where you are relative to a point in space. If I tell you that this is my XYZ, that this is my three-dimensional point in space, and then the patient is put in a position relative to that point, then we can orient around that point. We make sure that the pet is in the same position every day relative to that point. We make sure that the machine is pointing at the same place relative to that point every day. So understanding where we are requires three-dimensional planning, which is the CT scan. So we would CT scan or CAT scan a dog or a cat and use those images. As the human being, we tell the planning computer what's what. We say, here's the tumor, here's the eyeball, here's a brain, here's bone, this is what we're worried about. And then the computer program will help us model beams to say, if we shoot from these different angles, this is where this is what you're gonna accomplish. And then the human being, me, comes back and says, I like that, or this is unacceptable, I need less dose to the eye, I'm willing to make that edge a little bit closer. And so we make those decisions to do the best treatment plan that we can for each animal.
And your office is about ready to step it up a notch when it comes to machinery. You're about to launch a new high-powered machine to make your job even better. What are you receiving?
So we are investing in a variant TrueBeam, which is a top-of-the-line linear accelerator. It's used at lots of human hospitals. We will have a 6 degree of freedom couch, which is the thing they lie on, and that's very useful because we can get within. I brought a little caliper, so this is just a caliper. We would use this to measure tumors and tell us on the outside how big they are, but I have it set to 1 millimeter. So so we can get, this is how precise we can be. That's not even on it. Yeah, I can just get my fingernail in there. So, we can get very, very precise with how we target the tumors. That means that if you have a tumor that's perhaps this size, we can be this accurate and not be off to any direction more than that much.
Wow.
So because we can be that accurate with the help of a CAT scan, we can also be that accurate when we point at it, which means that if that tumor is sitting right next to an eyeball or brain or a spinal cord, we can sculpt our dose. We can deliver the dose of radiation that is as protective as possible to the nearby normal structures and still gets a good dose to the radiation, or a good dose of radiation to the tumor. So the TrueBeam will allow us to do that. We will have the ability to do intensity modulated radiation therapy, which is called IMRT, which means that when you are treating, the radiation is coming out of the machine and it is collimated or shaped as it comes out of the machine. And the first thing that happens is it's shaped into a square or rectangle, and then it goes through another filter that is a series of leaves, they're called, where they'll slide in and out to show to mimic the shape of the tumor. So if you have a crescent-shaped tumor, the leaves will slide around to create a crescent-shaped field, and that's the only place that radiation goes. And if you do that from a number of different angles, all of those will add up to all the dose you want on the tumor, but since in each angle we're sparing the normal tissue around, we get a very precise dose to the tumor and very little dose to the surrounding tissues. And then the 6 degree of freedom couch is useful because when we do it actually has a CT scanner on the machine, so at 90 degrees from our treatment beam, so we can do a scan to see exactly where we are relative to that point in space, that XYZ in space. We can know exactly where we are, and then if we're a little bit off compared to when we did the plan 3 days ago, then we can use images and line them up and hit a button, and it will help the patient move 2 millimeters this way and 1 millimeter that way, and just little nudges to make sure that it's exactly in the same spot.
Some exciting,
it's very exciting.
I was going to say it's some exciting times for your office, and also some
It is.
exciting news for future clients out there.
Yeah, we'll have great opportunities to treat pets.
Dr. Selting, it's been a pleasure having you on the Paul
Thank
Report
you.
to discuss radiation therapy. I wish you and your office the best of luck, and maybe at some point we'll get up to see that new piece of machinery so you can show it off.
I hope you do, and the nature of my job is I hope I don't have to see you for business reasons.
That's right, that's right.
But we'll have a lovely facility. A friend of mine once said that he said we're not going to get rid of cancer, but we can get rid of fear. You know, because I think when you get a diagnosis of cancer, like you said at the beginning, it can be scary. So my job is to help you not be afraid, to know, so that you know what to expect and what all your options are. And then I think there's a lot of there's a lot of power in being able to pick the right thing for your pet and be a good voice for your pet.
Well, you've been a great voice today. Thank you so much for joining us.
Thank you very much.
And thank you for joining us on this episode of the Paul Report. Again, I'm your host, Kelly Goodwin. We hope you'll join us next time.
Dave's Decorating Center is a proud supporter of the Power Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paul Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com. Additional support for the Paul Report on WEIU is brought to you by viewers like you. Thank you.